So I've just received lemon majority in my care, so I just want to check her doctor's orders before going into her room. I see that she has no allergies to any medication, and she's been ordered morphine 5 to 10 milligrams intramuscularly and gravel 25 to 50 milligrams intramuscularly because she's experienced a lot of pain and vomiting and nausea after a cesarean operation. So I'm going to go in and meet her and find out how I can help her. And wash my hands. Okay. Always wash your hands before going in. Hi, Majori. I'm Jill. I'm a student nurse. Is it okay if I call you Majori?
Yeah.
Okay. Good. So I heard that you're not feeling so good. Can you tell me what's going on?
I'm having quite a lot of pain, and I just do not feel well at all.
How much, what would you say out of 10 your pain is?
Probably about a 6.
A 6, okay. And where is your pain located?
All in my abdomen.
In your abdomen? Do you mind if I look at your incision and make sure everything's okay?
No, that's fine.
Okay. Okay, well that looks intact. Everything looks okay. Okay, and you're feeling sick, kind of?
Yeah, I feel really nauseous.
Oh, have you been vomiting at all?
A little bit.
Yeah, okay. Oh, I see the basins there for you. Okay, so your doctor has ordered for morphine that can be given for your pain, and also gravel that can be given too. Have you had morphine or gravel before?
I've had morphine before.
Okay, and you didn't experience any side effects from that, or dizziness, or?
Just a little tired, but that's about it.
Okay, and do you have any allergies to any medications?
Not that I know of.
Okay, I'm just going to check your band here too, just make sure. Okay, so we're going to be giving it intramuscularly. Have you had an IM injection before?
No, is it gonna hurt?
It might just sting a little bit when it's going in. Morphine tends to do that, but it'll be worth it for you because it will relieve your pain fast.
Okay.
Yeah. I'm just going to check. So I think that will go into the ventrogluteal because that's where the most muscle is and the least complications and no nerves. So it looks like you've got quite a bit of muscle mass and no atrophy. You're not inflamed or necrosis. Your blood flow feels good. Can I just check your cap refill here? Okay, and I'm going to check your other side. So I'm going to go ahead and get that ready for you then. But first I'm just going to take your vitals. So blood pressure, especially respiratory rate, because the side effect of morphine would be respiratory depression. So I would do all this to Majori, and I'm going to be right back after I get that ready for you, Majori.
Okay.
Okay. So just coming back to the MAR here, it's ordered about 5 to 10 milligrams or 5 to 10 milligrams of morphine. I'm going to give 5 because she does want to go see her son, and I want her to be able to do that, and also we don't want to give her too much if she doesn't need it. And then the gravel, I'm going to give 50 milligrams because she is vomiting. So usually I'd look up in a drug monograph when I'm at the hospital, but we don't have that, so we're going to use our drug guide. So first I'm just going to look up morphine and check the onset, which is rapid, and it peaks in about 30 to 60 minutes and can last about 4 hours. And the side effect, major side effect, would be respiratory depression. Also with gravel, I'm going to check that. And it mixes well with morphine, that's good. It has a 20 to 30 minute onset, a peak of about 1 to 2 hours, and a duration of about 3 to 6 hours. So after I give these medications, I'm going to check both of those. Also, after I check the morphine, I want to check the vitals about 15 minutes later, make sure her respiratory rate is still high, and to see if her pain has gone down. So I'm going to get everything ready. So I've got my gravel, 50 milligrams per milliliter. So I'm going to give 1 milliliter, check that to my MAR. And then I have morphine, 5 milligrams per milliliter, so another 1 milliliter. And also I would have the RN double check the amount that I'm giving of morphine because it is a narcotic. I have a blood fill needle and a 22 gauge needle because you do need a larger one going into the ventrogluteal, and 1.5 is a good size for an adult her age. A 3 milliliter syringe, alcohol swabs, a medication label, and gauze for after the injection. Okay, so I'm going to start getting the syringe already. Just open that up. And always alcohol swab the vial. When you have an ampule in a vial, you always do the vial first. Everything ready, be sterile. Oh, maybe we'll, not too hard there. Okay, make sure my syringe is good. Okay, and I can take the cap off now. Oh. So it's good to always check to make sure that it's right on there. Usually in the hospital we have the lure lock one. So I'm going to inject 1 milliliter of air into the alcohol swabbed vial. Okay, turn it upside down. And then with IM injections, it's easier to get air because they're larger. So I've got 1 milliliter of gravel that I've drawn up. Okay. It's good. Okay, that one's been opened a lot. Okay. Now I can put my blunt fill needle on because I am using an ampule. Cat is funny. Oh. Okay, so I need to grab a new needle because that fell. And put the cap on there. Okay. And that's probably good practice anyway to make sure. Okay. And I need another, oh, I have some in my pocket actually. Another alcohol swab for the morphine. Please open away from me. I've also checked all the expiry dates on these two. Okay. Okay, so I got all the medication out. I'm just going to pull back a little bit more and empty it into there. Good, so I have exactly 2 milliliters of fluid. I'm going to recap my needle. Okay, it's good to alcohol swab if you ever are worried. Okay, all my shirts. And just clean the area. Then I'm just going to write on my label here. So the patient is Marjorie, Lemon, room 1. So morphine, 5 milligrams, and gravel, 50 milligrams. Okay. Okay, and then I'm going to add that to this label to the cap just because I want it to be able to come off. Usually use a thinner thing, and I need a gauze pad. Oh, and I would write usually, oh, I'm going to take my marker. grabbed this while doing this because I'm such a careful nurse and realized that I put the blend fill needle ready to go. So, take that off. Marjorie, lemon, and now 5 milligrams of morphine and gravel 50 milligrams. Okay, so now my syringe is labeled, and I'm going to take the MAR to the bedside to do the injection. I would also wash my hands again before returning to the patient's room. Okay. Okay, Marjorie, so I've got your medication here. Can you just tell me your name and date of birth?
Marjorie Lemon, January 4th, 1979.
Perfect. And I'm just going to double check that again with your wristband. So your date of birth and your name. Okay, and I'll double check. Make sure I got my right doses here. Perfect. Okay, so we're going to get you set up. You're okay to go on your side.
Mm-hmm.
Okay. I'm just going to position you like that.
Okay.
Okay, so I'm going to landmark the area. So my heel of my hand on the greater trochanter, my thumb facing the groin, my finger at the iliac crest, and my other finger at the anterior and superior iliac spine. Like that. Okay, and then I'm going to put on gloves now. The blue gloves are much nicer to wear. Okay. Now I'm just going to alcohol swab the area. Starting in the middle and going 5 centimeters around. Then I want to use it to point to my injection site. Okay, I'm going to grab the medication, do my landmarking again. Okay. Okay. And 1, 2, 3. Okay, I'm going to aspirate for 5 seconds. Okay, good. So I'm in the muscle, and then I'm going to do 1 milliliter for every 10 seconds. And then hold it for 10 seconds. I just want to make sure the medication's in. Okay. It's all done, Marjorie.
Okay.
Initially I'd have it gone. I'm just going to use this to hold on to there. Okay. Good. Okay. Okay, and you can go back down now, Marjorie. And I'm going to come back in a little bit just to see if you're feeling better and if that pain's gone down a bit.
Okay.
Okay, and now I'm just going to go chart what I did and return in about 15 minutes to see if the morphine's kicked in.